So we put a little numbing cream on ahead of time. Voluma is kind of a different product as far as how we inject it. So any of our injectables that we use, the derm fillers, are hyaluronic acid. We never use anything that is permanent because this is the safest way to have a filler, and our body has hyaluronic acid in it as well. So it doesn't recognize it so much as an intruder. So we feel down on the, it's called the zygomatic process, and this type of filler goes straight in, and it actually sits on that bone. So what it kind of emulates like bed springs or pillars. So it's nothing like when we inject on these nasolabial folds or here, we inject and we fill and fill and fill till we see the correct result. But here, it's just, I'll do 3 injections, and it doesn't have to be all of it coming up. It just can be the pillars. Amanda's goal is to have a little bit more increased cheekbone. And when we first started using Voluma, we had some really great instructions from Dr. DeMaio, who's kind of the world injector of Voluma. And he said, since he started using Voluma several years ago, that he injects very few nasolabial folds or tear troughs, because if you increase this a bit, it kind of vicariously takes care of those areas without actually filling the area. Having said that, I still do lots of nasolabial folds, and on people of a certain age, the labial mental folds. So young women have nasolabial folds, but young women don't have, of course Amanda doesn't have this, but these folds down here are called labial mental, and they're really just a result of aging, loss of elasticity, and loss of collagen. This is a really common area to inject in people, late 40s or 50s, and it really makes a big difference. They don't have that sad face anymore. As well as oral commissures, which are these lines on either side of the mouth. We can inject those to put a little injection here and here, kind of make a C around there. And instead of the mouth kind of heading south, we don't want it to smile up, but we make it so it's just a little bit more neutral. And that in itself just is a youthful look. So we'll take this off. Because this is an injection on the bone, we need to make sure that we use a couple different cleansers. One's an antimicrobial cleanser, and then we'll take that off with some alcohol.
Cheri, what sort of longevity are you seeing with Voluma? How long does the result last?
Well, Voluma is touted because it's so thick, it's so highly cross-linked. It's touted to last 2 years, and I do see that. But I'm seeing people when they come in for like their Botox or something. It's been about 18 months for the Voluma. We start talking about it because it seems like if it took 2 syringes of Voluma the first time, that we can do kind of a booster at around 18 months and maybe just use 1 syringe, half on each side. And that's what I'm going to do on Amanda. We're going to use half a syringe on each side. And, our philosophy at Lawrence Plastic Surgery is that we're conservative. We want the patient to look like themselves, only just a few years younger. So we've had some people come in and ask for the wow factor, and Dr. Thelman and I sometimes say, but what about the whoa factor? So we sometimes, can start out, we can always add more. So we do markings for Voluma. And it must be the guy who thought it up. They're called Hinderer's lines. So we'll mark when she's up here. We just go from this oral commissure. And then this way. So this is our target here, where those kind of intersect. So here. And we'll take a peek. Sometimes I have to erase my lines. I'm kind of picky. Well, those aren't bad. So then we'll mark right where we're going to do our injection. She wants a little more fullness here. She's got nice here fullness because she's young and she kind of has, she has a lot going for her. Here. Where she wants it. Should be about right. I'm going to go ahead and lay it back here. And Amanda, this feels a little different than just an injection in your skin. It's a little bit of an odd sensation because it actually has to tap that bone a little bit. And I want you to tell me if you feel a zing or anything other than just that. It feels like you just had a little bruise or something. Not terrible, but if there's a zing or it's kind of a signal that I need to pull back just a little bit because there might be a little nerve or something and I don't want you to be uncomfortable. Okay, so we're going to get started, Amanda. This will be cold. I just think this helps a lot. She did have a little number on her face earlier. It's called BLT. It's benzocaine, lidocaine, and tetracaine. And we have Brad downstairs in King's Pharmacy compound it for us. And it's by far the best numbing agent that we've had. So we use that mostly for all our dermal fillers. And then my esthetician partner, Patty, uses it for microneedling and for the permanent makeup, the microblading that she does as well. So we'll get started. So I retract the skin just a little bit. And here we go. And I've tapped the bone. On each time of this injection, it takes a little bit of time because we have to aspirate to make sure that we're in the correct spot, that is not in a blood vessel. And then we inject very slow. This is the thick agent and we're down in a kind of a sensitive area. So that's the first injection. Doing okay?
Doing great.
Okay. I paid her to say that. Okay, and a little ice again. And this is another injection. We retract the skin and go in. And then we aspirate. And then inject slowly again. Is this feeling okay?
Mm-hmm.
Okay. We're just going to use one syringe this time.
What's the most you've injected in someone?
Usually one syringe per cheek. You can inject a little bit more than that. I always kind of like to have my patients come back and add more if they feel like they need more. This one's we're just going to hold a little bit of pressure here. Sometimes there's a little vessel underneath that's just like a capillary. And sometimes you do see a little bruising from these injections. We have to use a little bit bigger needle because the product is thick and we're a little bit deeper. So unlike Botox, where you can, it's very, very thin product, we can use a very fine needle. On these substances, especially Voluma, we have to use a little bit bigger needle.
Cheri, I can tell you that when we're doing facelifts and dissecting in this area over the malar eminence, it is particularly vascular. Not a lot of big vessels, that is, ones that you can see or identify or that have names, but it's very rich in capillaries in this area, more so than dissecting down here or here or anywhere on the face. This area here, it just oozes more when we do the dissection, and we know it's coming.
Right, right.
So it makes sense to think that you would see a little more oozing or bruising in this area.
Right. We don't see as much, even though this area is as vascular as well, we don't see as much there. And so I'm just going to get here. You doing okay?
I'm doing great.
All right. And we have one more injection on this side.
Cheri, what do you instruct your patients to help them minimize bruising after injections of Voluma or any of the fillers or Botox?
Yeah, good question. I really don't want my patients to work out, because if you are working out and lifting or running, then that increases your blood pressure, and then of course that just increases your chance of having more blood flow through that area. And if you have a little puncture wound there, that's where it's going to come out, and increase your chance of bruising. I ask my patients to ice a little bit off and on. I want to make sure that they know that this area is a little numb, because not only have we put number on, but the product itself has lidocaine in it, which is a numbing agent. So I wanted them to use ice judiciously, because I don't want them to create their own frostbite by putting ice on and leaving it on. And this one, we'll put right down here, big stick. Doing okay?
Yep.
Okay, we'll pull it back, look for our bubble. And then this one, we're just going to put one increment. Okay, that's side A. We'll go to the other side. How's that feeling?
Feels good.
Okay. When we're done, I'm going to massage it, and I tell my patients it's okay to massage on certain areas. If I'm doing lips and using a real thin agent like Volbella, which is great for lips, I don't really want my patients to massage that very much, because I want it to stay right there. Voluma is very thick, and since it's not given in a continuous stream, since it's in these pillars, I feel that massaging it kind of just brings it together a little bit more. So we'll do that in a bit. I like to use arnica gel. You can get it at Walgreens or Walmart or somewhere. It's just helps with a little bit of bruising. You've probably picked it up a time or two for aches or pains, or to rub it on a sore muscle. Because we've tapped on the bone, and we've gone in and out of the skin a couple times, I like to change the needle. It's still very fine and very sharp, but it could be a little bit dull. So for the benefit of the doubt, we'll just change it. And now we'll start on this side. So we'll retract the skin a bit and go in. feeling the bone there yet. Big stick. There we go. And then we'll put 2 in this side. You doing okay? Okay. Nice. And little sticks. One more, Miss Amanda.
Doing good.
Cheri, you started injecting fillers when they first came out, and they did not add a local anesthetic. They did not add lidocaine.
Right.
Now most of them are adding lidocaine, that is a local anesthetic, to their gel. Have you found that makes a difference?
It does. Because especially, you know, areas that have tons of nerve endings, like the lips, I mean, that's why kissing feels so good, because there's tons of nerve endings. If I can put a little bit of product in and then go back where I put that in and advance the needle past that, it's much more comfortable for the patient because they have the numbing in. It's just, the numbing is just like you would get if you know, have an injury and you need to be sutured, then your doctor will put, you know, the lidocaine or the numbing in, and then you literally don't feel the sutures. So it really helps in patient comfort a lot.
Cheri, are there things people can do prior to their injections, before they come in, to help with minimize the bruising?
Right. So before you have any injections, I really would like to see you and have a consultation. So we can look in the mirror together and we can decide, you know, what we can achieve. But I always want my patients to not take any of the non-steroidal anti-inflammatories or aspirin. And by the non-steroidals, I mean, you know, Advil, ibuprofen, those types of things, because those thin the blood. Before we have surgery, I think Dr. Thelman and Amanda like to have their patients be off from them about 2 weeks. I'd like it at least a week. The life of a platelets is about 2 weeks, and that's why they want to make sure that, you know, every platelet that's bathed in that medicine is not going to thin the blood then. But I also want my patients to know that, you know, this is an injection. I want them to make sure that they don't have any acne on their face. And if I'm doing their lips, if they have any history of having a cold sore, we just simply prescribe a prophylactic antiviral. And it's just a medication. We usually use acyclovir. You take 2 days ahead of time, the day of, and 2 days after. And it's just an inexpensive insurance policy that we're not going to stir up that cold sore virus. So I want, Amanda, I'll take off your, I guess I can sit you up, take off your lines. She may have a little bruise on this side.
Stop.
Okay. Oh yeah. In the name of love. I bet that one hurt. I just bled.
I know, I felt bad.
Like,
So go back to where you were, and then with the line, okay, now I'm going to sit her up. And
okay. Now I'm just going to sit her up here, and we'll take off her markings so she doesn't have to go home with those. I also prefer that my patients, for this type of injection, don't have dental work for a couple weeks afterwards, because you know, they stretch out the mouth that they're putting in, you know, a lot of instruments. And also dental work isn't the cleanest part. So I just prefer that the patients schedule when they don't have dental work. And I remind my patients of that as well. So we'll use a little arnica here. Put a little on each side. Massage that a little bit. How's that feeling?
Good. You can go a little bit up here to rub my temples.
Oh. Yeah, and now I'll flip over and I'll do a back massage. All right. So I have patients ask me, when will I see results? Well, with Voluma, you pretty much see the results. She has a higher cheekbone here, there's more definition, it brings that up. That's the look she was going for. With other derm fillers, if I were to do nasolabial folds or her lips or here, the results are, of course, right away, but I only inject to about 80% of the effect that we want. Because the product itself, the hyaluronic acid, is hydrophilic, meaning water-loving, so it absorbs maybe about 20%. So if we fill to 100%, in 2 weeks she'll be 120%, and that's an overfill. So our Lawrence Plastic Surgery is so conservative that we would rather have the patient come in. You can always put more in, but filling to about 80% is about right for us. The lips, patients go home and their lips are pretty big when they leave because they swell immediately, and a lot of times if they love them then they're going to have to come back in because some of that is lip swelling. So I see those patients back in 2 weeks, and sometimes we put a little bit more in. Thank you, Amanda. You're a great patient. I know that's a little bit uncomfortable, but I don't think you're any worse for the wear, and you're a great palate to inject. Thanks for coming by today.